Did you know that your bones are living tissue, constantly changing? But sometimes this process slows down, and that's when problems like osteoporosis arise. Osteoporosis is a condition where bones become weak and brittle, making them more susceptible to fractures, even from something as simple as bending over. Imagine your bones as a honeycomb. When you have osteoporosis, the holes and spaces in that honeycomb become much larger, reducing the density and strength of your bones. The word itself means porous bones, and that's exactly what happens. Over time, bones lose their density, becoming more fragile. It's often called a silent disease because people don't usually know they have it until they break a bone. So why does this happen? Let's take a quick look at what goes on inside your body. Your bones are constantly being broken down and rebuilt. Cells called osteoclasts break down old bone tissue, while osteoblasts create new bone. This process keeps your bones strong. But with osteoporosis, this balance is lost. Bone breakdown happens faster than it can be replaced. This results in weaker bones over time. Osteoporosis affects people of all ages, but it's more common in older adults, especially postmenopausal women. Why? Well, hormones like estrogen, which help maintain bone density, drop significantly after menopause. This leaves bones more vulnerable to osteoporosis. But it's not just women who need to be concerned. Men are at risk too, especially as they age. By the time you reach the age of 50, 1 in 3 women and 1 in 5 men will experience fractures caused by osteoporosis. You might be wondering how osteoporosis impacts daily life. Well, it's more than just weak bones. Imagine breaking your wrist or hip from a minor fall, something that wouldn't normally cause an injury. Now think about how long it would take to recover. For many people with osteoporosis, healing from these fractures can take months, or worse, lead to long-term complications like loss of mobility and independence. Something as simple as walking or carrying groceries can become a challenge. And for those with severe osteoporosis, even coughing can lead to broken bones. Now let's talk about the warning signs. Many people don't even realize they have osteoporosis until they suffer a fracture, but there are a few subtle signs. One common symptom is a gradual loss of height. You might notice that you're an inch or 2 shorter than you used to be. Back pain is another red flag. It could be a sign that one of your vertebrae has collapsed due to a fracture. And of course, frequent fractures from minor injuries are often the biggest indicator that osteoporosis has taken hold. If you're wondering how to know for sure, a bone mineral density test is the best way to diagnose osteoporosis. This simple, non-invasive scan measures the density of your bones, allowing doctors to determine if you're at risk. So what can you do if you're diagnosed with osteoporosis? The good news is that it's not too late to take action. Through a combination of lifestyle changes and medications, many people with osteoporosis are able to maintain or even improve their bone health. Nutrition plays a big role here. Specifically, getting enough calcium and vitamin D to keep your bones strong. Exercise, especially weight-bearing activities like walking or lifting light weights, can also help strengthen your bones and improve balance to prevent falls. In summary, osteoporosis may be a silent disease, but its impact on health and quality of life is significant. By understanding the condition, recognizing its warning signs, and taking steps to protect your bones, you can live a strong and active life, even with osteoporosis.